And I'm wondering what the status is for the state of Colorado applying to the federal government in order to try to line up these amendment issues. Because it's my understanding that the federal government could still come to the state and shut people down and arrest patients and this sort of thing. So what is the legislature doing to stand up for the people of Colorado and our amendments? Supposedly our states are supposed to have some power over the federal government doing these things?
So, federal law preempts state law. That means they're the boss. But, so here's the thing with medical marijuana, in case you weren't aware. So, in federal court, it is still against the law to possess marijuana, even though certain states have medical marijuana. And the reason you've seen so many more dispensaries and people with medical marijuana cards now in Colorado is because when Obama became president, he discouraged the Department of Justice from prosecuting people for medical marijuana. Technically, it's still illegal at a federal level, and they could still, in theory, come and raid any place if they wanted to, but President Obama had said he didn't think that was where he wanted to see the war on drugs going. It wasn't worth expending the time, energy, and money on that to let states do what they wanted to do. It's always been a bit of a tension, I think, even within his own Department of Justice. There are people in the Department of Justice who just have this, you know, that's wrong, I can't believe we have to do this attitude, and they keep issuing new rules to try and figure out, you know, how they could maybe stomach to live with what's happening at the state level. And so the thing we most recently heard about was they decided that dispensaries couldn't be within 1,000 feet of schools, and that's led to some problems. And so at a state level, we actually can't do anything to overturn the federal laws at all, except what some of our delegation is already doing, which is trying to decriminalize marijuana, but there's nothing within our own legislature we can do. And as a state, we're actually a little bit more progressive than many in terms of laws that Colorado has already passed around marijuana. I've heard that there will be a ballot initiative about making marijuana legal in Colorado. I've not heard what the polling shows on that of late. The only big piece of legislation I know Senator Stedman is carrying, I think with Representative Massey, is one around trying to figure out a way for dispensaries to have access to some kind of banking system, because that's been a barrier for many of them, and that legislation hasn't started yet, but will be coming through our legislature, and I would expect it to pass. I think it has bipartisan support. Yes, ma'am.
I've heard there's another bill on fracking, but I don't know if it's a House bill or a Senate bill. Have you heard anything about a bill in addition to the Oil and Gas Commission bill?
Yeah, I know Senator Morgan Carroll has one, and it's related to that if an oil or gas company does fracking in an area where there's potentially some substances that could be harmful. She's thinking about out in Lowry, I guess, where there's some potentially some nuclear wastes around and things, that they need to have some money set aside in sort of a trust, so that if they do something bad, there's money there to clean it up right away. And she described that to me, and I know she's still working on it, and I don't know when that will be coming forward, but that's one of the bills Senator Carroll is running. And I know somebody else is trying to run a bill saying that that the local government can set regulations saying that you can't build, you know, in certain areas close to housing and stuff. So those two will be coming through at some point in time. They're not active forward yet.
There were two in the House that died in committee, and I couldn't tell you what the subject was, but I do know they both died. So.
Any other questions? Yes?
Yeah, I don't have a question, but I just have an announcement.
Okay.
If you guys know or have any family member or whatever with brain injury from, I don't know, car accidents or veterans or anything, Brainstorm up in Lafayette. It's a free, like, all-day conference, including lunch. And it's going to have Senator Aguilar is going to be speaking about legislation concerning health and things like that for people with brain injuries. So if anybody's interested to see me, and I think there still might be spots available, so I want to thank the Senator for coming to speak.
There is also a community health organization, and I can't remember their name right now, but they're having a summit around community health and prevention. February 25th at the Denver School of Science and Technology. I think it's from like 8:30 till 2. I know about that because I actually was the keynote speaker for that as well. I don't have it with me, but if you email my office, we can get you that information on that conference. It was supposed to happen February 4th, but we had a snow day, so it got moved to the 25th of February. So if anyone's interested in finding more about prevention and stuff, one of the interesting things I've learned about in the last year is around the whole, a lot of the things that are done environmentally for your health in terms of the built environment and being sure there are places that you can walk and get exercise and walking to healthy foods and things like that, and how much that can improve the health of communities. So it's really great to see people looking at health holistically and not just at medical care. I mean, in many ways, medicine is disease care. And when you talk about health care, you should be talking about prevention-related things like, in fact, one of the statistics I like to quote is that if you look at what determines the health of a population, only 10% is what we provide in medical care. 40% is actually behavioral. Things like whether you exercise, whether you smoke, whether you're obese, whether you use substances or practice dangerous habits. Another, about 15% is genetic, so you can't necessarily fix that. But another 10 or 15% is environmental, and then some is social poverty issue related things. So really, if you're looking at keeping people healthy, you have to get them doing healthy behaviors. Any other questions?
Well, I got one. I think all your bills have come up in this discussion except for the hospital charity one. Could you just
Yes.
give a quick...
So I have a fun bill coming up on committee on Thursday. And I was just sitting in a meeting with a lobbyist from Denver Health, and I said, don't tell me Denver Health is going to oppose my health care bill again. We'll see where we're at. But so I don't know how many of you have had the experience of going to the hospital and getting a hospital bill, and the hospital bill will say charges $1,000, insurance owes $500, you pay $20, or something like that. Well, if you happen to go to a hospital and you don't have insurance, all you'll get is the bill that says $1,000. You don't get that cut rate because your insurance has negotiated that cut rate. And so one of the bills I'm running that will be up at committee on Thursday says that that hospitals can only charge the uninsured what it actually costs to provide services. Awesome. Now, interestingly, it's based there are published data, and I don't know if we're going to get dirty and show this or not on Thursday. Probably not, so I'll tell you now because it's fun. There's public data that shows that unnamed hospitals in our area charge 600% of costs. And the best hospitals charge, best meaning most fair in my mind, charge 146% of cost. So, so this bill will say that if you're uninsured, they can only charge you cost, that they have to, before they send you to collections, they have to screen you and see if you might be eligible for Medicaid, or if you're a kid for CHP Plus, or if they offer it for this Colorado Indigent Care Program. And then if you're not, they have to work with you to develop a payment plan at which you're not required to pay more than 5 or 10% of your income per year on your hospital bill so that you won't go bankrupt. And so that's hospital bill, Senate Bill 134. It's called the Hospital Payment Assistance Act. And I have to say that actually our Colorado Hospital Association already has a pretty good charity care policy. We just don't know how many people are really following it. And also, we don't know how many people in the public know, because You talk to paramedics, they will tell you that there are people who refuse to be transported to the hospital because they're not insured and they have enough that they have something to lose, and so they don't want to risk dying and leaving their family with nothing. And so if nothing else, hopefully this will just make people feel safer about taking care of their health, knowing they're not going to go bankrupt if they end up in the hospital. So that's Senate Bill 134, which comes up on Thursday in committee. I'm working on it with Colorado Consumer Health Initiative. And speaking of days in the Capitol, Thursday is their Healthcare Day of Action, where they'll be educating people about how you influence public policy, and they want to try and get people to the hearing on this bill as well. And they'll have a breakfast and a lunch, I think, with legislative panels and stuff. And then with the Colorado Center on Law and Policy, and that's a nonprofit organization that works to really be sure that our safety net is kept intact and working for people. They're big defenders of consumer rights, elder rights, and Medicaid. One of the arguments that I've been hearing a lot, so historically, and again, I haven't been in politics very long, but apparently the historic thing is that Democrats have wanted more money for schools and Republicans feel like schools get too much money. And that's a tension that's always been there. And the Republicans think that schools get too much money because of the teachers' unions. And the Democrats think that schools don't get enough money because class size is too big and stuff like that. And so there's always been this tension there around that. So what's amusing but scary is to watch the Republican messaging, because schools and funding schools polls well with voters. And so the Republicans are very concerned about the national debt and about how many things we have to provide for our people who unfortunately are losing jobs and living in poverty. It's not like they're asking for things they don't unfortunately qualify for. But anyway, so lately what we'll hear them saying is that they're really concerned about how we're going to be funding schools in the future because Medicaid is costing so much money. And so I want you to know that that's a false choice. As Coloradans, as U.S. citizens, we don't have to pick between sick kids and uneducated kids. We can take care of both of those problems, but it does take looking at our structural defects in our tax system and how we do things in our country. And I don't think that any of us want to see us leaving our elderly and our disabled without access to basic things to keep them alive and safe. But they do such a good job at messaging that Susan was telling me, she was talking to a good Dem the other day who said he had talked to a Republican on the Joint Budget Committee and understood why she was so concerned about Medicaid because of its impact on education. And I thought, oh no,
I know,
the message is going across.
She sounded really bipartisan.
So it's.
I do have a question about, because I've heard that specific Republican ask and want to apply for waivers on Medicaid, and I'm not quite sure what kind of waiver that they're asking for. And I know that's not something that the governor wants to do, but I don't understand the waiver, so if you could explain that.
So Medicaid is a federal-state partnership, and the federal government sets sort of the minimum of if you're going to take Medicaid money from us, this is what you have to do. And so when people are asking about waivers, what they really want a waiver is from having to do what the feds say you have to do if you get Medicaid money. And so what that entails then would be, for example, right now, if you take money from the federal government for Medicaid, any pregnant woman who's living in poverty, you have to give her Medicaid and cover her pregnancy for prenatal care. But if you had a waiver, you could choose whether you were going to do that or not. Right now on Medicaid, if you offer somebody Medicaid and they don't make more than 100% of federal poverty level, then you can't charge them more than $6 for a co-payment for a doctor visit. If you did a waiver, you could charge them as much as you wanted. So that's why they keep asking for waivers, is that they don't
So we
like.
would still get federal money?
You would still get federal funds, but with the waiver, you could set the rules for who could apply, how much they could get, and what they had to pay in co-payments and deductibles to access health care. And then but the main reason why people, progressives don't want a waiver is because once the federal government sets a number and gives you a waiver, that's all you'll get from them. And so if for some reason the economy, you're Detroit and your economy tanks, your number is set at that number for a year. And then you're trying to make it go until the next go around at those old numbers that you can't sustain anymore. And so that's one of the reasons why people don't want to see a waiver happen. The other is that there's this, you know, a lot of people feel really strongly that if you give somebody something for free, they don't value it. And they really object to the concept of giving people free access to any kind of health care. And unfortunately, I think what they don't realize is that even when health care is free, there are people who won't access it because they don't believe in it, because they're afraid of it, because they don't have the time, it's inconvenient, whatever it might be. There are indeed some people who abuse low cost or free access to health care. But I think rather than changing the rules for everybody, you need to find out who those people are and work on changing the rules for them. Because the majority of the population, there have been good studies that show that if you, for example, raise co-payments for mammograms, women won't get mammograms anymore. And so then, again, you're dealing with it at the long end where once they have breast cancer and a lump, you're finding it instead of doing the screening beforehand. So it's just one of those basic philosophic differences, again, between the two parties, I think, is the concept of the role of co-payments in healthcare and access to healthcare. So, all right, we are at just about...
I was going to say, I thought that was a really good bill that you mentioned, the 134. And we're kind of in a strange situation where we have health insurance, but we almost always pay out of pocket. And so, you know, people don't realize that you're paying, what'd you say, 600% more?
Yeah, I want to know what hospitals those are.
If you go look at a few ways,
You want to
you'll
buy
figure it
stock?
out. I tell you, they're not in central Denver. How's that?
Okay.
Yeah, yeah. Well, thank you guys for coming. We have a bunch of flyers here.
And a sign-up sheet.
And we have a sign-in sheet if you're not on my email list. I do want to tell you, I am having an event with T.R. Reed. He's going to be showing his movie, U.S. Healthcare, The Good News, on the Ides of March, March 15th at the Mercury Cafe Theater. The event itself is free. I'm having a fundraiser afterwards where you get to sit around with just the two of us and 30 of your closest friends. But the event itself is free, and even that talkback is free. We never refuse people because of money. So that's coming up. And then here's, I have this great local guy who does my printing. I guess I forgot to tell him I wanted these half the size. These are postcards. So if you'd like one for your window, you're welcome to take it. And we have some bumper stickers, and if you're not on my email list, please put your name down so you can get my newsletter. Thanks.